So electronic health records are a valuable resource to help healthcare providers share information about patients in real time, improve the quality of the data, and empower patients to be able to understand and track their own healthcare needs. But we all know there are errors. A health record system doesn't always match the patient's health records to the right person. For example, when somebody has the same name and the same birthday, they may get switched, or human error in a lab might mean that they end up assigned to the wrong patient record. And I understand these mismatches can be dangerous. They also can be very expensive. Dr. Goodrich, you oversee efforts at CMS to ensure the quality in healthcare settings. And quality means, at least in part, accurate patient matching. So can you just say a word about what the dangers are to a patient when their medical records are not accurately matched in a medical setting, when there's a patient misidentification?
Yes, absolutely. Unfortunately, I have witnessed actual harm to patients in my clinical practice that have been as a result of patient mismatching. So, as you point out, when one patient is mistaken for another because of an identical or similar name. So we know this does happen. And patient mismatching can result in the wrong patient getting the wrong treatment at the wrong time. Mm-hmm. And that, of course, can lead to actual harm to patients and, of course, medical error. It also can result, though, in inefficient care. When incorrect tests or diagnostics are performed and the patient then needs a duplicative test later on once the mismatching is identified. So that, of course, can contribute to increased cost to the healthcare system.
So money and the fact that people
Yes.
could actually get hurt from this. So a 2012 survey found that 1 in 5 physicians encountered mismatched information that led to illness or injury at least once during the preceding year. And then a recent report showed that medical error, including patient misidentification, was the 3rd leading cause of death in the United States. Dr. White, you work on patient matching issues at the Office of the National Coordinator. Why is it that the health IT systems used by hospitals and doctors don't always accurately match patient records?
So you actually outlined 2 of the reasons that might happen. There might be a lot of John Whites that go to a given hospital. Or John White might have mistakenly had more than one medical record number assigned to my name. So my CAT scan wasn't in the same place as my blood tests. So even though a hospital uses the same system, that doesn't always preclude you from having patient matching issues. We're actually quite encouraged by some of the modern approaches to matching people to their information. We're certainly taking a look at approaches like biometric identifiers and a couple of other different approaches. There's actually a very robust interest in the private sector. This is an issue that they really want to see solved. We've been very closely following the CHIME Patient Matching Challenge with great interest, and we think that there's going to be some good approaches on the near horizon to address the issue.
So I'm very glad to hear this, that we're working on ways to address the shortcomings in the current system. It's part of the reason, though, that Senator Cassidy and I worked along with Senator Hatch and Senator Whitehouse and Senator Baldwin on a provision in the 21st Century Cures Act that requires the GAO to produce a study on patient matching. And that's why all 5 of us sent a follow-up letter to GAO earlier this month reminding them of the urgency of this issue and requesting that they produce some clear recommendations for improving patient matching methods in their final report. So I look forward to working with both of you to improve safety and quality of our health information systems so patients can get the care they need. So thank you very much for your work, and let's get this done.